Hello, everyone, and thank you for joining in to our webinar recording of Prism Plasma. Today, we are joined by one of my favorite people, Dr. Raminder Saluja out of North Carolina. She's going to go through all things Prism Plasma and make sure everyone understands the full capabilities of this technology. Dr. Saluja, thank you so much for being with us.
Thank you so much, Josh. And you're one of my favorite people as well.
Oh, thank you.
But it's such an honor to be here today to talk about Prism Plasma. I practice in Cornelius, North Carolina. We just moved into our new office in July. And a little bit about my philosophy. We basically bring patients in, and our main philosophy is to educate them, to see what's appropriate for them, if this is the right technology for their skin type, and what their aesthetic goals are. And we do have a podcast. It's called Just Laser It, 3 words. You can find it on Apple, Audible, or Spotify. And episode number 24 covers Prism Plasma. And these are less than 20-minute Audible presentations. So hopefully you'll tune into that as well. But let's go ahead and begin. And when we talk about Prism Plasma, this is a dual modality system. So it differs from some of the other modalities that are out there. It has a fractional handpiece that has Voltaic Arc Plasma, which we're gonna talk about more throughout this presentation, and the cap technology, which is cold atmospheric plasma. And there are branded treatments. There's Prism Purify, Clarify, and Fortify. And hopefully by the end of this presentation, you'll be very comfortable with how this technology works and what those treatments are. So first, this is an FDA-cleared 3-in-1 plasma device. Now, I've just told you that it's got 2 hand pieces, the fractional and the cap. So what is the third component? It actually has a digital scanner. So it elevates these treatments in the sense that you are now precisely placing these little Voltaic arc technology pinpoints into the skin in a digital format. So here are the 2 hand pieces, the fractional plasma, which think about the fractional plasma as your structural type of distribution that you're going to have. This is what's going to build your collagen and elastin. And you can think about the cold atmospheric plasma, and again, we'll go into detail, as your regenerative handpiece. I mean, right now, the whole buzz in the cosmetic industry is regenerative, and we're going to talk about how this turns on cell signals. So first, what is Voltaic Arc Plasma? I know we all kind of know a little bit about plasma in general. It's the 4th state of matter, solid, liquid, gas, and then plasma. Voltaic Arc Plasma differs from pure nitrogen, for example, the age-jet plasma, in the sense that it's working with the atmospheric plasma rather than pumped-in nitrogen. So in our atmosphere, we've got 78% nitrogen and 20% oxygen. So it's ionizing that gas and creating a little spark of energy. And this arc of energy is directed axially towards the skin, are creating this energy. So there's 25 different electrodes on this handpiece. And we have a little tip that's centered on it. We'll show you that in a second. And it's directing this energy and creating ionized gas with the atmospheric air. You can, when we talk about the cap technology, you can almost smell the ozone. But as it creates this voltaic arc, it's creating a spark. And we'll show you what that spark looks like in a video here in a moment. And it's inserting these little microthermal zones, which then starts the whole collagen wound healing cascade to build elastin and collagen in the skin to help with those fine lines and wrinkles. So there are known voltaic arc technologies out there. There's a plasma pen, there's Subnovi, there's Opus, etc. And we have the plasma pen in our office. We've had it for about 8 years. And I've utilized it, but I basically relegate it to very small zones, maybe sebaceous hyperplasia. And part of the reason is that it takes so long to lay this down. So when you have a plasma pen, in order to deliver the energy, you have to be about 1 to 2 millimeters away from the skin. And even in the best technique, the best hands, there's always going to be some variation. You might be 1.1 or you might be 1.5. the closer you are to the skin, the more of an impact it's going to leave. And so sometimes it can create a wound that takes about 7 to 10 days to heal. The further away, of course, the less energy you're going to get in. So with this device, it has got the tip on it that's basically your spacer. You place it on the skin and you know you're giving the exact type of spacing energy as you march along. So that's one thing. It improves upon the technique. The other thing is that the time consuming component. If I'm laying down one pulse at a time, it might take me, a second to lay down a pulse. With this, you can lay down 25 pulses in less than 3 seconds. So if you're doing 250 pulses across the face, that's 750 seconds. That's about 12 and a half minutes or so. So I typically will do these in about 25 to 30 minutes, which takes into account taking off the numbing medicine, delivering the energy, talking to the patient about post-care, and that's plenty of time. The other thing to consider too is because it's got the spacer component with the tip, you don't worry as much about creating the craters that might lead to pigmentary changes. So there's many components that make this, that builds in the safeguards into this tip. So this is basically what we talked about. How does it improve upon the technology? Much faster. And so then you can treat that neck, you can treat that face without having to worry about the time that it takes to do it. And time is so important, not just for the practitioner with chair time, but it's equally important for the patient as they're sitting there in your chair, wanting to have this procedure, done and over with. It is not as painful either because it gives these precise little wound healings. I still numb for it, but it's a very comfortable, tolerable treatment with the numbing, with the BLT numbing that's placed on it. Much easier to utilize, which means that it's much easier to delegate. And certainly that's important in a practice as well. And the tips can be reutilized. So you can get about 1,000 pulses or so per tip. There is also the Prism Plasma handpiece. This is a single needle handpiece. It's great for skin lesions. There's a video that will show this as well. So if you've got a skin tag, you can also use it for sebaceous hyperplasia, just a touch at the tip of the sebaceous hyperplasia. Now, when it comes to stretch marks and scar revisions, I still like my 25 electrode tip with the little tip that I can place all of those large zones into it to get more of a density into the skin. So again, this fractional plasma handpiece, you can select how many little pulses you want to place into the skin. So I typically use the 25 one for the face and for the neck, because again, back to just what I said, I want as much density as possible. But when I'm going around the eyes, I sometimes will choose the one that has 13, the diamond. It's easier to get into those areas. The eyes are a little more sensitive for sure. And so what's also nice is you can select your energy settings. So on the face, I'm typically at 6, sometimes at 7 with my energy setting. On the neck, I'm at 5 to 6. Around the eyes, I'm about at 3. So that also differs from the plasma pen, which is just basically one spark of energy without the ability to modulate the energy settings. So here's a treatment overview I want to show and walk you through.
Hi everyone, I just want to show you something. This is a plasma pen, which delivers energy, and it hurts a little bit. It delivers when I touch. You can see those little spots there. And the problem is you have to hover a certain distance. Sometimes it's a little deeper, as you see here. Sometimes it's not as deep, which you see right there. And it's a little tiny zone to elicit the changes. Now this is fractional plasma. The nice thing about this is I can set the energy to wherever I want to go. I can go higher on certain patients. I can go lower on certain patients. On my hand, I'm going to do a little bit lower. And because it touches my skin, you can almost see the sparks, but I can then adjust the energy, and I'm laying down 25 zones so I can cover a big distance on the face. So this is fractional plasma. It's becoming one of my favorite devices.
When you are placing down this energy, you can see that the energy goes in an axial format, and it's really working with the whole entire matrix to build a collagen and elastin to help improve the quality of that skin. It gets down to about the papillary dermis with the heat, and then that turns on the fibroblasts to stimulate the collagen and the elastin. Here's another example of the single pin. So you can use it as a cutting tool to just cut away at those skin tags. And here are the type of results that you can see. So again, this patient was numbed for about an hour. We went over the skin and you can see the fine lines and wrinkles, especially in that malar area, how that's improved, and the texture of the skin looks more radiant. Here's another patient. You can see those fine lines over the skin of the frontalis, and sometimes those stubborn static lines can be present despite utilizing Botox and neuromodulators, and so that improves the quality of the skin. Here's another patient, again, post one treatment with acne lesions. Now, the great thing about this, and we're going to go into CAP here in a moment, is you can lay down the fractional handpiece first to improve the quality of the scarring of the acne scars there, improves also the pigmentation, but then you can end it with a little bit of the CAP technology hovering right over the cystic acne lesion that you see here. And then again, improvement of the texture of the skin. So that is the fractional handpiece. Now, what is CAP technology? So think of your fractional handpiece as your structure. Think of your CAP technology as your biochemical regenerative handpiece. And the way that it does this is that where you get the Voltaic Arc with your fractional handpiece, this one lays out kind of a radial display of plasma. It's a plasma shower. And in the process of doing that, it creates reactive oxygen species and reactive nitrogen species in the skin. And we'll talk about what that means. And it's also very well tolerated. This one you don't need to numb for. So that's why it's very easy. And I'll tell you one little story before I get into all these little bullet points here. But when we got the technology in our practice, and it was known to help with acne, I kind of want to put it to the test. So every single patient that came in for Botox that was sitting in the chair, if they had an acne lesion, I would turn on my CAP, I would take it to continuous mode, and I put it on a level of 4, and I would hover over that acne lesion for about 20 seconds. And I would text them the next day and say, how did you do? And my toughest patient is my sister. And so I would ask them how they do. And lo and behold, 99.9% said it was gone the next day. Sometimes they'll say it's gone at 36 hours, but I would say the bulk, almost 100%, it was gone in one day. It's really a phenomenal treatment. So how does it do this? How does it make for that acne lesion to be reduced? Well, what it does, it creates, again, reactive oxygen species, which is bactericidal, fungicidal, virucidal. So you're killing the bacteria that's creating the P. acnes to begin with, and it just shrinks it down. It's anti-inflammatory, and that's why it's also nice to couple it with eczema or psoriasis patients, because you can really reduce that inflammation, which we'll see on some photographs here. It also helps with the follicular environment, and I will talk more in detail about that, but it can help create something called plasma poration in the skin, and it creates these transient little openings in the stratum corneum by oxidizing the lipid in the stratum corneum. So when it does that, it changes the permeability, which is very important when you're talking about hair regeneration and improving the scalp background as well. And it also is important when you're talking about allowing for topicals to penetrate into the skin. And especially in this day and age of exosome technology, when you do something like this, you can have an exosome facial where you change the permeability, and then you place the biologics on top. So what are those branded therapies? Well, there's Purify and Clarify, and there's also Fortify, which we'll talk about next. Purify is just the overall skin health. So we talked about the reactive oxygen species. There's also reactive nitrogen species. And remember, low levels of this is important. We know that high levels for prolonged periods of time can really relate to prolonged inflammation, but the low levels that it creates in this transient period of time are actually cell signals. So the reactive nitrogen species can help with the microcirculation of the area, so it can improve the quality of the skin. And then you couple that with oxygenating the skin, you really can get some minimization of inflammation. And you can also get some wrinkle reduction. Now, when I talk about wrinkle reduction, I'm typically first doing my fractional treatment, and then I'm doing this on top. In regard to clarify, my esthetician does this procedure where she will go all over the skin with the cap technology. Again, no numbing is necessary for this. Takes her about 20 minutes to do this, but she'll go all over the skin first, and then she'll hone in on the acne lesions and hover over them for about 20 seconds, and you really can get some benefits. I think for an active acne patient, you do need successive treatments, probably every 2 weeks, could even be weekly, to try to get that incremental improvement on the acne, minimization of the bacteria on the skin. And so here is an acne treatment. You can see where we just hover over that acne lesion. You hear it crackling. It creates this radial energy on top. I hover it for about, does not hurt. You can see when I pull this off here in a moment that it's basically just minimally red. And the patient will let you know that there's hardly any discomfort with it. And they'll smell that ozone. I tell them it smells like the great outdoors when we do this, because you'll smell that created ozone that's present there. And so this is what it looks like, the two tips, your cap technology there that gives that radial distribution, that plasma shower that goes over the skin to help with the environment of the skin, creates that ozone, that gives that antibacterial, and it's bactericidal. It's not bacteriostatic, so it helps with that component. And here are some photographs. So this patient, we did an IPL for her rosacea, and then we thought, let's see if we can couple it with the cold atmospheric plasma to help with the papillary component to it and help minimize the inflammation even more. This is post-1 treatment. Here's another patient. This is actually a combination of my fractional treatment, so my fractional handpiece, where I wanted to have some better structural improvement of her collagen, and then I ended it with the cap technology to help with the inflammatory portion to her skin. And you can see some benefits to the vascularity as well. This patient, we combined both the fractional handpiece, I did that first. Then I did a 1927 nanometer laser on top. And this is post-1 treatment. This is, I think, 16 days post-1 treatment. And you can see some nice benefits. Here's a patient that had cap technology only. And again, you can see the benefits post-1 treatment with the inflammatory acne and the level of just generalized redness to her skin. Here's a patient of mine that I did this on, 1 treatment, and you can see just a couple of days later, the improvement of her acne lesions. Again, right here as well, someone that you can work with to help improve the quality of the skin. This is someone that I would personally do the fractional first and then do the cap second. Now, what is the Fortified, the third branded treatment? This is the one that promotes hair growth. And how does it go about fortifying that scalp? Well, 1, it stimulates hair follicles. So again, remember we discussed how it creates this plasma poration, so it allows for the energy to get down to that hair follicle. And there was a recent study that shows that it turns on its cell signals, and it turns on the Wnt and the beta-catenin pathways that get down to the dermal papilla cells. And so when it does this, at the dermal papilla cells, the DPC, it turns on the growth factors to keep you in anagen. So and remember, your DPC is your command center that works with the stem cells. So you're also turning on anagen and getting you back into that growth mode. Very important, the cell signaling that occurs here. It also minimizes the bacterial flora, so it makes the scalp more receptive to creating the environment to stimulate hair growth, and it improves the circulation so that it basically brings in exogenous nitric oxide to help dilate the vessels and improve the micronutrients at the hair follicle. So let's see it in action. And you can see it goes over. And remember, it doesn't hurt. So it's not creating a thermal injury to the skin, but rather it's giving the cell signaling and creating this regenerative component. And, you know, for the past 2 decades, what have we had? We've had hair restoration by placing the hair follicles back, which will always be there. That's not going to go away. But the emphasis now is what we can do from a regenerative standpoint that can take our own stem cells in our own body without even adding exosomes, but you add exosomes and you modify it even more to help grow that hair. So it's pretty exciting to see that cap falls into that regenerative component. And here's post one treatment. You can see the before and after. And so I think that more studies will come out so that we can discern, how often do we do this? How many treatments are necessary? What can we expect? And the longevity of it as well. When do we retreat? So that's kind of the end of it. It's really a neat system. It has a small footprint, so it's easy to wheel into a room, one room or the other. But we use it so much. We have two systems in our practice because that cap is always going, both in my esthetician room and my PA room. So it's nice to have that. But that's pretty much the basics of it.
Awesome. Thank you so much, Dr. Saluja. Over the last several weeks, working with different providers, we've actually been collecting different questions that are kind of coming up more prominently. So we wanted to put some of those into the webinar here and have you go ahead and address some of those just so that we could really kind of help educate people a little bit further. So I'll run through those with you. The first one we have here is asking what makes plasma-based treatment safer and more versatile for really the different skin types compared to a traditional energy-based device?
So when you think about traditional, even if you think about lasers use selective photothermolysis, so it's chromophore dependent, right? It's targeting hemoglobin, melanin, water. This utilizes plasma energy. So the plasma energy is ionized gas that's non-chromophore dependent. So you can use it on any skin type without that worry. Now, so there are times I dial the energy up or lower depending on the skin type, but it's not ablating away the tissue. Very, very high settings, you can get sublimation, which is a form of ablation, but we utilize it at about 6. The other thing to recall is that it keeps your epidermis intact. So when you're not at that high sublimation levels, you're keeping your epidermal component intact so that, once again, it's easier for darker skin types. We don't worry about post-inflammatory hypersensitivity and whatnot. So it really makes it a safe, delegatable type of procedure.
With Fortify for hair regrowth, how does that actually support the hair regrowth? And what role does plasma play in scalp and follicle health?
So again, this directly relates to the cell signaling and what it can do. Because remember, with the cap, it is not the thermal component that we always like to see with regeneration of collagen and elastin, but rather it's creating that low-level reactive oxygen and nitrogen species. It's changing the sebum content as well. It oxidizes the lipids. It creates that opening so that you're allowing that plasma to get down into the hair follicle. You're improving the microcirculation with that reactive nitrogen species and creating exogenous nitric oxide. And you're basically, Josh, minimizing the bacterial content so that it is more receptive to the hair growth. And again, if you do use exosomes or whatnot to help grow the hair or different growth factors, it allows for that penetration. So there's so many different ways it's helpful. And the nice thing is that you don't need a numb for it. You don't need to have any type of lidocaine blocks or anything like that when you're doing this.
So would the normal protocol be doing the cap treatment with Prism, and then if you were using something like exosomes, you're then doing those topically on top?
For sure. I mean, think about before we were doing microneedling a lot, right? Which is painful to the scalp area. And this, you do that first, and then you put your exosomes on top. So it's really very easy to do. And remember, your cap does not have consumables. So you can really go over the scalp so much, and you're not incurring extra cost with that either.
Who would you say is an ideal candidate for these treatments? And how do providers typically integrate these services into their existing practice?
Well, I think anybody who wants to improve the texture and the quality of their skin can be an ideal candidate for this. And you can utilize it on any skin type. Just to give you demographically what I see in our practice, my Prism Plasma, the fractional handpiece, I'm probably doing that more on my 40s, 50s, and 60s patients. The cap, I'm doing it on everyone, but the cap pulls in my younger patients as well, because typically those are the ones that are bothered by their acne eruptions, and they don't have a lot of downtime. They want to come in after school, get it done, and then be able to go to school tomorrow. And you don't really have any downtime. You don't have to call in numbing. It really makes it an easy treatment. And then certainly, as you were talking about the hair growth, you have it for that as well. So really anybody. Maybe the
Right.
ones that it's not for is if someone needs a surgical neck lift. Okay, my fractional handpieces maybe not going to do that for them, but it might improve the quality of their dermal health post facelift.
What is cold atmospheric plasma, and really how does Prism Plasma use it differently than some of the other devices?
Hopefully now you know what cold atmospheric plasma is. I hope, if I've done my job right. But the other devices, so let's say you get a device and it's a plasma device, and it's usually a thermal based plasma device. I mean, we call them still cold, but it gives more thermal energy, and you only get that. This device has got both the voltaic arc, so you've got the prism fractional component, but the cold atmospheric plasma is different than plasma pens because it's giving this radial distribution. This is basically your regenerative handpiece. So it differs from plasma pen. It differs even from traditional plasma as well, in that you're really getting more into the cell cycling component and not so much into the thermal component. So I like this device because you get both. You get more of the slightly thermal component and you get the regenerative component. And you can go off in all sorts of different tangents of what you can treat by having these two modalities in the practice.
So I know you have age jet in your practice. Do you ever find yourself using kind of both of these in combination, or really how would you even go about doing that?
Sure. Okay. So you could do a triplicate type of treatment. So you would first lay down your fractional component with the prism plasma. You would do that first. You would lay your little pillars of structure. Then you could go over it with age jet to kind of confluently treat everything. And you could do it at low levels, 1.5 with the age jet. It doesn't have to be at the 3s and the 4s. So it makes it a very doable treatment. And then finally, you can end with cap to minimize any of the inflammation that's present there. That's one way to do it. Another way, Josh, is that when you're doing microneedling, you can lay down cap first to minimize bacterial flora of the skin, do your microneedling, and then end with a little bit of cap as well. So you can make a cap sandwich in a way, because sometimes with microneedling, patients worry about acne breakouts afterwards. And so if you can minimize the bacterial flora before you place it on there and then use the cap afterwards to minimize inflammation, that's a nice treatment too. And cap doesn't take long to do at all. I was saying that the cap facial that they do is 20 minutes because she really goes at it. But if you lay down a little couple minutes of cap before, do microneedling, 2 minutes of cap afterwards, it's quite effective in that regard.
That's great. And also the fact that it doesn't have the consumable, you don't have to worry about really incurring additional expenses for that.
No,
So it's kind of a win-win.
I think that's key. And again, cell signaling and wound healing is so very important with everything that we do. I think it could predict whether the outcomes are good or bad. So why not use it post energy based devices to help improve? You don't have to put them under an LED for 20 minutes, although I like LEDs too. I like red light therapy as well and near infrared, but this is very quick and easy and does something different than what red light therapy and near infrared light therapy does.
So how does Prism Plasma complement other aesthetic regenerative treatments already offered in the practice? We've kind of touched on this quite a bit. So I guess to reword this would be, are there any other treatments that we haven't discussed that you have found success with combining, or maybe that you are looking forward to combining?
I just like it from the regenerative cell signaling aspect at the end. I think it's wonderful to combine that with basically any energy-based device to minimize it. But even post CO2, post erbium, fractional erbium lasers, you can do a little cap afterwards as well, just to help with the healing process of it all. But I really like it for the exosome facial. Why would it's very easy to do and do the exosomes afterwards, especially in someone who doesn't want to have any type of downtime.
Well, thank you, Dr. Saluja. This was very, very informative. Um, I'm personally excited to get my first Prism treatment done here very soon. The device and what you can do, I think there's many of us that are excited to get the treatment done and also perform the treatment on patients. So are there any other final thoughts or anything else you'd like to share before we end today's broadcast?
Well, this is one thing I would say. So let's say you're signing up for a demo of this device. Pick somebody in your practice that has an acne lesion present and use it. You'll be amazed.
Well, and I think also from a marketing standpoint too, if this is a device that you bring in, there's so many patients in your practice that suffer from acne breakouts. That is such low-hanging fruit. Get those patients in, get them treated. It's very rewarding for them. And then it helps you build up your library of before and after images very, very quickly. How long after treatment would you say people typically will see the results with those breakouts?
Oh, 24 hours. I mean, it's remarkable. I would literally, Josh, text them the next day and they'll be like, it's gone, it's gone. And I couldn't believe it. And so that's when we said, okay, let's institute this Clarify component where we can do these acne facials, because it was such home runs. And what's great is to kind of make patients believers in it too. Just when you do treat it, it literally takes me 30 seconds to do, 20 seconds to hover over it. And so it's very doable. They don't need a numb. And it just is, it's really exciting. I mean, when we were working with it with Neo Concepts, we were both so excited to see the results. We kept saying, here's one day, we kept sending photos. So it really is rewarding in that regard.
That's great. And there's very few devices where you can do a treatment and see a result within that short of a time frame. So, from a provider standpoint, being able to get those results and share those results, that just helps you promote the device much faster. So really, really great piece of information.
Very good. And we all have short attention span. So that's why it's good for you to follow up the next day and say, how'd you do? Because
That's
2
true.
weeks from then, they won't remember,
Yeah, exactly. Well, Dr. Saluja, as always, amazing job. Thank you so much. Hopefully I will see you soon, and hopefully we can do another webinar soon. But until then, I hope you have an amazing, amazing start to your 2026, and we will be in touch soon.
Thank you so much. You too, Josh.
Thank you. Bye-bye.